It's been nearly 3 years since the first confirmed case of COVID-19 in the state of Oregon. The health authority press release at the time called it a case of the novel coronavirus. Since then, the OHA has been giving regular updates on the cases, variants, vaccines, masking, and a whole lot more. And we thought it'd be good to check back in on one of those meetings, see how things are going now.
COVID-19 test positivity has increased in the last 2 weeks. However, COVID-19 related hospitalizations have been stable, following a steady decline since late December. We believe that the XBB.1.5 Omicron subvariant is now predominant here in Oregon and is likely the cause of our recent increase in test positivity. We do not know if this will lead to increasing hospitalizations.
That's tape from the last update, most recent, and those variants, I have long ago lost track of which one we're on. The Centers for the Disease Control predict that COVID-19 hospitalizations will remain flat this month. The state epidemiologist that you just heard from says the formal wind down of the pandemic response is underway, and they're seeing real positive changes towards a new normal with COVID-19. And with this new stage in the pandemic comes conversations around things like mask requirements. Oregon is on a short list of just 14 states that still require people to wear masks in certain settings. Washington is on it as well. In both states, masking is required in healthcare facilities like hospitals and clinics. Those requirements, though, they could be going away in the near future if COVID vaccination trends continue in the right direction.
86.6% of people 18 and older in Oregon have received at least one dose of the COVID-19 vaccine, while 24.5% have also gotten the bivalent booster. If these trends continue, we anticipate being able to safely lift the healthcare masking requirement over the coming months. Thank you to all the healthcare providers who continue working so hard to provide care for us as we need it. But we are still operating under an emergency because of the hospitalizations for patients with respiratory diseases. This allows our healthcare partners additional flexibility to care for patients that show up for needed care.
Along with vaccination trends, OHA will look at other factors before lifting those mask mandates, including whether or not COVID-19 turns out to be seasonal, like other viruses.
We don't yet know if COVID-19 is seasonal, but we have seen large peaks through the winter, and we anticipate that that will go down in the spring. COVID-19 cases, again, they've ticked up slightly when we look at percent positivity in wastewater, but our hospitalizations have remained stable. We hope that in monitoring those trends over the next couple of weeks and in looking at what our staffing is like in hospitals and the current declaration of emergency on the state level, that we'll be able to provide some criteria that we would be looking at, that we would say that healthcare requirements for masking would go away, and individual systems and providers will make that decision. I can't give you an exact date when we'll give you that information, but I anticipate in the next week or two, and that masking requirement will likely go away in the next couple of months.
Another discussion during this meeting was about the end of the federal emergency declarations related to the pandemic policy. That includes things like free vaccinations, free testing, and the waiving of some out-of-pocket expenses. Those declarations are expiring in May, but OHA says there won't be overnight changes to things like free vaccines. But the sooner you get them, the better. And when it comes to at-home test kits, the guidance from OHA is simple: stock up now while you can and while they're still free. Medicaid and Medicare recipients need not worry. Kits and other COVID-related medical expenses will still be covered well after the federal emergency ends. But those with private insurance, you may want to scoop up a few tests to hang on to. There will also be changes being made to the way people access drugs used to fight COVID once you already have it.
For example, on February 1st, the U.S. Food and Drug Administration, or FDA, removed the requirement for a positive COVID-19 test result prior to prescribing the antiviral medications Paxlovid and Lagevrio, which reduced the risk of severe COVID-19 infection in individuals at increased risk. This change acknowledges the limited accuracy of COVID-19 tests and allows providers or prescribers to consider symptoms and exposure history when diagnosing and treating COVID-19 infection. This ensures anyone with risk factors for severe disease, such as people 50 and older, those with underlying medical conditions, those who are under or unvaccinated, and individuals from communities of color and tribal communities can more easily access potentially life-saving antivirals.
OHA officials say the elimination of red tape when it comes to access to treatment is critical as well, especially since hospitals don't have enough workers. Getting around some of the extra hoops like referrals can save us time and the system money. And tonight we have a special request for you, the Story viewers. We're working on a series of reports about long COVID symptoms or COVID symptoms that last a lot longer than the normal COVID infection. So if you or a loved one is dealing with long COVID, we'd love to hear your story. Send us an email, won't you? The address is thestory@kgw.com, or you could call and leave a voicemail with your name and number at 503-226-5090. I'll be calling a few of you back to chat about your experiences with long COVID that we may include in our reports.